innovation for sustainable development. I've seen quite a number of my friends here, some that I haven't seen after UNIDO intervention in Nigeria's infrastructure quality. I've seen, at a point I saw the I saw the former deputy governor of Kano State here. At the appropriate time, yes, thank you so much. And at the appropriate time, we'll ensure that everyone is recognized. I've seen my friend from research. I've seen all of you who are very interested in what is happening today and forging ahead and making it a useful one for development in Nigeria. But I'm more excited about the women who conscripted me to doing this today. My young lady, Dr. Uju, who is the special advisor to Mr. President on public health. Public health is my passion, so you just got me there. I also have here a man that I've worked with very closely, and I'm very proud that today he stands as the President, Nutrition Society of Nigeria, Professor Salisu Meiwada Abubakar. Well, I saw him all and about, but at the appropriate time again, would call people out individually. I've seen Naima, I've seen all kind, the conglomerate of those of us here makes it an exciting day for us. So we'll start with the technical session, and that shouldn't be too much of formality. And so I met her, I would say, on television in person, but she comes across as one who believes in Nigeria. At least those of us here have decided not to japa, so we're here for great job. And I'm excited about the fact that she's also the program director and technical lead of Grand Challenges Nigeria. We know that Grand Challenges Nigeria, Grand Challenges Africa, Grand Challenges Global. We have our sisters, I'm sure, and our friends here. Some of them would introduce them later. But we need to start, and the technical session will take place now. Please, some ground rules. Keep your phones on silence. Phones on silence, please. Then the ushers are ready to take you to lead you to the conveniences outside this hall. During the technical session, we'll, as much as possible, restrict our movement so that we don't become a distraction for those who are very seriously listening in to what will be happening today. So please, movements should be such that do not amount to distractions. Conveniences are outside this hall, and I'm sure the ushers would take you in. You can see the ushers in black and orange neck ties, so they'll be able to take you around and meet your needs. So we'll continue, and we'll start now with the introduction to Grand Challenges Nigeria. We need to know, what are they about? We need to know who is anchoring with them. We need to be sure that, in spite of the fact that Dr. Uju worked tirelessly to get us this venue, we need to know what we're doing. And so I would just ask immediately to Professor Folake Samuel, Program Director and Technical Lead, who would give us the foundation, very important. And I want that applause to be on. I can share a secret with you. She went to bed at 4 a.m. this morning, so we need to give her a very loud round of applause to energize her as she comes to speak to us. Thank you.
Thank you very much, Chief Makojola. Distinguished guests joining us both physically and online, partners, ladies and gentlemen of the press, I would like to adopt any existing protocols that have been laid by Chief Makonjola. I want to introduce us to Grand Challenges Nigeria. Today's event crystallizes a year's work for Grand Challenges Nigeria in defining why we exist, the impact we hope to make, and how we will go about this assignment. To start, I would like to offer some context on what we mean by a grand challenge. The concept of grand challenges is traced back to the year 1900, when the renowned mathematician Dr. David Hilbert presented a list of 23 unsolved mathematical puzzles that focused the efforts of mathematicians for the entire 20th century and beyond. Hilbert's Grand Challenges framework has since influenced some of humanity's most ambitious projects, from placing a man on the moon, to eradicating polio, to mapping the human genome. In fact, the well-known Millennium Development Goals and Sustainable Development Goals, as well as efforts to develop a COVID-19 vaccine, also follow this framework. So, what is the framework of a grand challenge? Grand challenges are not merely routine research questions. They are visionary directives that demand achievable solutions to exceptionally difficult problems and produce outcomes that potentially affect millions, if not hundreds of millions of lives. Grand challenges require a multidisciplinary approach, mobilizing research across various fields. Grand challenges capture the popular imagination and thus garner political support. So, by way of history, in 2003, Grand Challenges in Global Health was proposed as a research initiative launched by the Bill and Melinda Gates Foundation in search of solutions to health problems in the developing world. Starting in 2010, funders in many countries began to establish Grand Challenges initiatives, including GC Brazil, GC India, South Africa, and GC Africa, which is a Pan-African program, among many others. These GC initiatives work independently and together as part of the Grand Challenges network of partners who use the model to accomplish dual objectives. First, identifying and supporting innovative solutions to the world's toughest problems, while at the same time fostering and strengthening an innovation ecosystem in places where we will have the most impact. So Grand Challenges offers a model that other funders and governments, particularly those in the low and middle income countries, can use to dedicate more resources to scientific discovery and innovation, particularly in health and development. Although the records show that individual Nigerian innovators, about 600 of them, have benefited from existing Grand Challenges initiatives, there is no Grand Challenges Nigeria focusing on the unique local contexts of Nigeria, the local issues and needs that we face daily until now. Today, that changes as Nigeria joins the Grand Challenges network of partners, which together seeks to intentionally build and strengthen communities of innovation funders and support and connect grantees to a global network that boosts their potential. It is therefore with great honor that I introduce the Grand Challenges Nigeria, a national project of the federal government of Nigeria, anchored in the Office of the Vice President and the Federal Ministry of Innovation, Science and Technology. Grand Challenges Nigeria is implemented by the Nutrition Society of Nigeria, which, having raised the initial funding, has garnered the support of government and non-government partners for seeding, scaling up, and sustaining innovations in health and development in the country. These partnerships align with national priorities and leverages Nigeria's existing strengths and strengths in science and innovation. Our mission in Grand Challenges Nigeria is to build a platform for jointly identifying strategic areas for investment where Nigerian innovators, researchers, practitioners, and others can unite to address local grand challenges. As I get to the end of my speech, allow me to illustrate our approach with a simple yet profound example, which is the evolution of the mechanical door lock. We all have door locks in our homes. The door lock began as a simple solution to a universal challenge, the need for security and privacy. This modest intervention originated around 2000 BCE. It was called the pin lock. And it was originated in ancient Egypt, here in Africa, where, by the way, a lot of good things happen. For example, like man, we originated here. And so, initially crafted from wood, this pin lock evolved over the centuries with refinement from other innovators, until we now have the sophisticated locking systems that we rely on today. It is remarkable that this seemingly simple idea has shaped the course of human civilization. Similarly, Grand Challenges Nigeria, though in its fetal stages, aims to drive transformative change and will harness innovation in country and build a brighter future for our nation, such that with sustained national support, this initiative will grow, adapt, and scale just as the door lock did, expanding from a simple concept into a lasting, powerful solution that safeguards our collective future. Here at this event, various experts will present you with difficult developmental issues that we are facing in Nigeria, and they will use the Grand Challenges framework to look at collaborative innovation that we can do to address these issues. We will also announce the first request for proposals that will define the first of the several issues that will galvanize efforts for Nigerians. We hope to leave you inspired. Let me end by thanking all of you for being here today to lay this foundation with us. On behalf of the Nutrition Society of Nigeria and the governing board of the newborn Grand Challenges Nigeria, we extend our immense appreciation to the Grand Challenges network of partners for the welcome and support accorded us from inception. Dr. Moses Alobo and Dr. Fatih Badien flew in to join us in person. We appreciate you. Special thanks must also go to the Office of the Vice President and the Federal Ministry of Innovation, Science and Tech and Innovation for their incredible support as they worked tirelessly with the Grand Challenges Nigeria team towards the success of this launch. I must mention Mrs. Uju Anwuka, the special assistant, the special advisor to the President on Public Health, and I must thank Mr. Adebayo Adeyemi, the Director of Health, Biomedical Science, Federal Ministry of Innovation, Science and Tech, and their team. Thank you very much. I invite you all today to join in this work of fashioning just one more key to the doors that Nigerians must walk through. Thank you very much. You are welcome.
Thank you very much, Professor. Please, can we give her another loud round of applause, setting the stage and bringing us all up to speed on what to expect today. I'd just like to do a little introduction before I ask members of the panel who would be sitting on these empty chairs behind me. Please welcome with me a very energetic young woman making development and making nutrition an integral part of what we should be pursuing as a nation. Today, she stands in as the Special Assistant to the Vice President on Public Health. She also was the one who conscripted me in front of this microphone. Please welcome with me Mrs. Uju Van Stesia Anwoka. Please welcome her very, very warmly. Thank you so very much. I also have the GCN group here with us. We have, of course, Professor Hafiz Abubakar, former Deputy Governor Kano, Board of Trustees, Nutrition Society of Nigeria. You're welcome, sir. Professor Salisu Abubakar, who today is the President, Nutrition Society of Nigeria. You're also very welcome. We have here with us also Ekanem Isichie, Deputy Director Policy, Advocacy and Communication, Bill and Melinda Gates Foundation. You're welcome. The entire Advisory Board of Grand Challenges Nigeria, you are also very welcome. I know that we have from the ministries, particularly the focal ministries, and of course from the office of the Vice President. Please, if you are here, you are duly recognized. I would call out your names when I have them ready. And we also have here members of the academia and research institutions. You are all very, very welcome. I know that we have development partners here. My friend, the contact and the lead of the DRPC, she's here with us. Ma'am, you're welcome. We have also non-governmental organizations ably represented here. And if I've missed you out, please, you are all welcome. At an event like this, you can't call people individually by names, but you are all very, very important. I'd also like to welcome very distinguished and vibrant ladies and gentlemen of the Nigerian media. You are also very welcome. So we have this going, but at the moment, we will have to go straight to business. And business is helping us to achieve the objective for which our professor has spoken to. I'd like to call out the names of the panelists as I have them here, and in exact manner in which I was given. I'd like to call out Mr. Adeyemi Adebayo, Director of Health and Biomedical Sciences, Federal Ministry of Innovation, Science and Technology. Thank you very much. Can we please lead him here warmly? Thank you. I'd like also to follow quickly Mr. Ekenem Isichei, Deputy Director of Policy, Advocacy and Communications, Bill and Melinda Gates Foundation, Nigeria. Thank you. Dr. Peter Ame, Medical Operations Lead, Helium Health. Dr. Moses Alobo, Head of Programs, Science for Africa Foundation and Grand Challenges Africa. Professor Olaoluwa Fabian Akinwale, Director of Neglected Tropical Disease Research, Nigerian Institute of Medical Research, NIMA. Professor Latif Sani, Executive Director and Chief Executive, Nigerian Stored Products Research Institute. Thank you. All right, I'd like to also bring on our moderators this morning. I understand that Chimdu Onwu Diegu, partner Dalberg Global Development Advisors, is here. Thank you. And of course, the Program Director and Technical Lead of Grand Challenges Nigeria, Professor Folake Samuel.
Good morning again, ladies and gentlemen. It is our pleasure to welcome you to this panel session. And the theme is Driving Innovation for a Sustainable Future for Nigerians. Today, we will be your moderators.
Good morning, everybody. My name is Chimdion Diego.
And I am Folake Samuel. So as we have heard this morning, innovation, we are here about innovation. And it means creating and applying new ideas, new methods, new technologies to solving our recalcitrant problems. So the objective of this panel session today is to explore and promote innovative strategies and locally relevant solutions that can address Nigeria's critical problems. And to help us to achieve this objective, we have a distinguished member of panel here. We have Mr. Adeyemi Adebayo, Director Health and Biomedical Sciences, Federal Ministry of Innovation, Science and Technology. You're welcome, sir.
Thank you. Good morning, everyone.
We have Mr. Ekanem Isiche, the Deputy Director, Policy Advocacy and Communications in the Bill and Melinda Gates Foundation, Nigeria. You're welcome, sir.
Good morning, and thank you for having me.
And Dr. Ame is the Medical Operations Lead of Helium Health. You're welcome.
Thank you very much. Good morning, everybody.
We also have with us Dr. Moses Alobo, the Head of Programs, Science for Africa Foundation, and the Grand Challenges Africa. Welcome.
Thank you, and good morning.
Professor Olaoluwa Fibian Akinwale is the Director of Neglected Tropical Disease Research at the Nigerian Institute of Medical Research. You're welcome, ma.
Thank you very much. Good
And
morning.
last but not the least is Professor Lateef Soni, Executive Director and CEO of the Nigerian Stored Products and Research Institute, NISPRI. Welcome, sir.
Thank you very much. Good morning, all.
Great. Thank you, everyone, and thank you to the panelists. So the way this is going to run is that there's going to be 2 questions to each panelist. So first round of questions will go, and then second round of questions. We are allocating 3 minutes to each question. So please, we would like us to keep to time, and we'll try to ensure that we do that. The questions are going to be rotated alternately by Professor Samuel and I. And if there are any clarifications when we ask the questions, please feel free to ask. Thank you.
Thank you very much, Chimdi. So our very first question goes to Dr. Peter Ame from Helium Health. Helium Health has been a very key player in leveraging technology to address critical health challenges in Nigeria. And notably, Helium Health received a grant from Grand Challenges a while ago to develop a digital antenatal risk stratification tool. So today we're going to ask him a question about that. Dr. Ame, following your experience with projects like this, what specific strategies can ensure the scalability of telemedicine and digital health in Nigeria, as well as low-cost diagnostics that can help us to address maternal and child health in Nigeria?
Thank you very much. And again, thank you for the opportunity of being here. In trying to address or trying to build technology, again, I'll be referencing the antenatal risk stratification project that we did. We always try to look at when you're bringing technological solutions, especially to low resource regions, we always try to see how we could build technology with the consumers in mind, or people that are going to use it. It's always best that whatever you build has to be customer-centric, yes? And this is very important. Looking at the anti-dignitary stratification, I call it ARS project that we did, we're looking at building a tool that women could use to check if their pregnancy is at any risk, and then they'll be able to get recommendations, right? So using that to see how we can leverage technology and scale, the first thing was to make sure that whatever we build, you have to build with your stakeholders. So having stakeholder engagement is actually very important. So we needed to build first a questionnaire that we could leverage those questions from, and also build the technology that it will be hosted upon. And in trying to do that, we made sure that we carried our stakeholders along. Stakeholders being first the providers of service, and also those who actually will be using the tool itself. So in trying to create the questionnaires, we try to make sure that we use sort inputs from health professionals, all the way from those at the lower levels through to those at the ministry level, to make sure that whatever you're building, apart from the fact that it will be standard, it's also localized for the regions that you're in. So you don't build something that doesn't follow with what the practice is in the region that you are located. You have always want to build things that are relatable, right? They are standard, but they are also relatable in the regions that you are in. Secondly, looking at the people that you're going to build for, if you're building technology for any disease condition, trying to build something to sort one issue or the other, you have to look at the people who are going to use it, because it's technology-based. We built this technology for those in underserved regions, and for us to even build, what technology are we going to use? Where are we going to host these questions? We had to literally look at the people that we're building for and see exactly what kind of technology they're exposed to, and what will best fit exactly what we build. So there might be no point in building something really huge that they can't use in the community that you are going to put it in. So you need to build something that fits the community they're in, looking at what kind of technologies they have, what would they be able to use, and it has to be very user-friendly. So you build things that people can actually relate to. Secondly, you don't just build technology and let it be. There has to be capacity building. You need to literally train those who would be using technology directly and indirectly too, so the health professionals. So if you're doing any technological solution, you have to be able to train people who would use it, or try to make sure that it's easier for them to use, so they'll be able to use it and then continue using it. I think thirdly, and another important point would be that in trying to build solutions for the community, you need to find a way of making the community accept your solution. So in that case, you need community entry, right? You need to partner with the heads of the community, because they will look at it and be like, why should I use this technology when I could go about what I was doing before? But to bring that impact, you need to leverage on the community to actually, get to the people that at the ground level. And then fourth, which the last point I'll bring here, is when you build technology, you have to be able to take feedback a lot. You want to scale technology. You want people to keep using it. You want to see how exactly they're experiencing with the technology. So you don't build and dump and go. You literally want to build, and at every point, take feedback, look at what data you're having, what errors might be having or not, and use it to iterate with the technology that you have to make sure you have different loops or versions of that technology for leading to the best version that you would have. With this, you should be able to actually build good technology for the community and scale it in a way that they have it and they use it.
Thank you very much for those wonderful points. Strategies to ensure that we can scale telemedicine. You've talked about co-creation, consumer-centric creation, end-user feedback, and so many other points. Thank you very much, Peter. We'll come back to you, but right now, ask Chimdi to continue.
Thank you, Professor Samuel. Mr. Ekanem, we know the Gates Foundation has led a lot of work in maternal and child health in the country. How do we ensure that funding and resources are directed at the most impactful and innovative solutions, particularly, like he mentioned, in underserved regions where we continue to have systemic barriers?
Thank you for the question. I think the first thing I'll say is investing in mothers and children is a development priority for us. And the fact is that the lives of mothers and children is also a national development issue. What we have seen is that maternal and newborn child innovations can save lives up to 260,000 people per year. And if you also invest $1 in maternal and newborn child innovations, you will get about $87 of social benefits. So in other words, there's a math to the work that we do even at the foundation. The other thing I'll also add is that the Bill and Melinda Gates Foundation has also been part of the Grand Challenges program from inception. I think to date, they've done about 4,000 investments through the Grand Challenge program and about 85 investments in Nigeria in particular. And now going down to your question, so what we have done is to work with the Federal Ministry of Health and the National Primary Healthcare Development Agency to see how can we map areas that have the highest burden of maternal and newborn, what do you call this, mortality rates, so MMR rates. So the first thing we did was to map that with them. And so at the moment, we currently have an assessment that shows the hardest hit areas with the highest level of maternal mortality rates. And then, so what are we doing around that? We decided to come up with 3 solutions to see how can we begin to think about addressing this issue. The first one was to look at what we call the E-Motive. The E-Motive is a program I'm trying to roll out through the PPH, postpartum hemorrhage. Postpartum hemorrhage is the highest, it's the single responsible source of why there's a high maternal mortality rate in Nigeria. And so the E-Motive is a compendium of different solutions put together to see how can you solve that. The second solution we're looking to scale and we're currently working on is around MMS, which is the multiple micronutrient supplements, which is given to a mother, a pregnant mother. So it looks out for the nutritional status of the mother and the child. By doing this also, you also avoid some level of deaths that could occur due to postpartum hemorrhage. And then the third one is really around a program called REACH, which is Resilience Through Azithromycin for Children. And what we have figured out is that this strategy has been quite effective in prolonging lives of children, especially under 5 children. And then the other thing I wanted to add is the fact that we've been working with the Federal Ministry of Health, like I mentioned earlier on, but also the Office of the Vice President and also some of the, under the Federal Ministry of Health, the Nutrition Department, and the Office of the Vice President. We're working on a program called, and based on the recent consumption and micronutrient states survey. I had to look at my notes to make sure I could pronounce it correctly. And so the whole idea is to look at what programs are actually targeted towards addressing the hardest areas that have issues around malnutrition. So how effective are those programs? So we roll out a lot of programs, as you know, generally, but the question is how effective are those programs? So that's what we have been doing over at the Gates Foundation.
That's really helpful, and I think it's great to hear how there is the importance of targeted solutions based on mapping of the need areas and also multi-stakeholder collaboration to ensure that there is no fragmentation of solutions as well. Professor Akinwale, we know that the Nigerian Institute for Medical Research has done a lot of work in molecular diagnostics, as well as disease surveillance to be able to combat infectious diseases. It would be great if you could share some of your key successes and how these outcomes can be leveraged further to ensure that we have innovative and impactful solutions in the space.
Thank you very much. I'm very happy to represent the Apex Medical Research Institute in the country, the Nigerian Institute of Medical Research, on this panel. We know that managing infection in Nigeria is faced with several challenges, one of which is early detection of infection. And many people, especially in hard-to-reach communities, remote areas, suffer from infections that are not detected, and many of them die. So the Nigerian Institute of Medical Research tried to bridge the gap of this early detection of infection, and we came up with many innovations. During the COVID pandemic, the Institute came up with 2 assays that helped the country in detecting and controlling the pandemic. The first one is the SARS-CoV-2 isothermal molecular assay, SIMA. And the second one is SARS-CoV-2 detection assay, which is the SCODA, which we deployed and in collaboration with the Nigerian Center for Disease Control and Prevention, we're able to use these assays to manage the pandemic successfully. And the Nigerian Institute of Medical Research is very proud to play this role. And then we also came up with some innovative kits in detecting diseases that are of public health importance, the viral infections like yellow fever, Lassa fever, monkeypox, and hepatitis B. We have these kits, we launched them, and they are very affordable, cheaper than the foreign kits, and have the same sensitivity and specificity with these kits. Currently, we are developing cholera detection kits because we know that a lot of our people are suffering and dying from this infection. And these kits, what our innovators are trying to do is to make sure that these kits, with these kits, we don't need any expertise or specialized equipment, and they can be deployed to rural areas, rural health centers, with little or no supervision. So the Nigerian Institute of Medical Research has really taken a front row in trying to bridge this gap of early detection of infectious diseases and to save as many people as possible from dying from this infection. Thank you.
Great. Really happy to hear about the affordability aspect of this, as that's critical.
Yeah, they are quite affordable, like I told you. They are cheaper than foreign counterparts, and they are equally sensitive and specific. They are easily accessible. We are in Lagos. We have other stations in Borno State, Niger State, Delta. So we are everywhere. So you don't need to order and wait for months like we were doing before, to wait for the foreign kits. So they are affordable and accessible, specific and sensitive.
That's great.
Thank you.
Very interesting discussions from homegrown local solutions, innovations, and how to make strategies work to issues around funding of innovative projects in Nigeria. And now I would like to ask Dr. Moses Alobo a question. Given your extensive experience in Science for Africa, funding grand challenges projects across the African context, we would like to hear your thoughts about what the high impact investment areas are, which are the most promising for maternal and child health challenges in Nigeria, given the array of different contexts in African countries.
Yeah, thank you so much, Professor, and it is our honor and pleasure to, come and support this particular initiative. We are from Science for Africa Foundation, Grand Challenges Africa, and our group has been doing quite a bit of work on the continent, for the last 10 years. But I'll focus on a few things that we've done recently that we think can be able to contribute here. We did a research prioritization exercise for maternal and neonatal child health that the report came out in 2021. And this year, again, we did convene a funders forum where we brought together all the funders in maternal and neonatal child health on the African continent, and then had a discussion around if we are to go ahead and have the best buys, investments that will give us the highest return on investment to reduce the neonatal and maternal mortality ratios, what could those potentially be? And we identified 4 grand challenge areas that we think that investments would actually get us there. Of course, better care during pregnancy, better care during birth, and then better postnatal care for women and newborns, and then of course, for the sick newborns, better hospital care would be absolutely important. And then these are things, of course, that have been done for a very long time, but what we are currently insisting is integration of new methodologies into this piece of work. So for example, integrating artificial intelligence, integrating genomics, integrating pathogen genomics and also human genomics, data sciences, and also their translational aspects. The interesting thing is that the reduction in the rate of neonatal mortality and also maternal mortality has decelerated. And it's as if we've now reached a plateau over the last 10 years. And questions are now being asked, what is it that we potentially need to do if we are to move forward and make sure that we are hitting the SDG targets? So we do recognize that there are some knowledge gaps. We do have knowledge gaps as a global community, and I'm not just talking about Africa alone, in the understanding of stillbirths, in the understanding of preeclampsia, for example. At the same time, the innovations that we usually put together, you know, they face a wall. They face a wall of scalability and transitioning to scale. We think that if we do these two particular areas and then make sure that we bring in other disciplines into innovations building, then we should be at a better place. So as I close this particular question, I'd just like to add that we had a look at the data that was coming out of West Africa, and I'd just like to mention a few things. Things that came or bubbled to the top from the 900 investigators that we sampled. There's a need to develop innovations that assist mothers in recognizing the danger signs in sick newborns, so that our mothers, our fathers, and any caregivers of children do not stay at home with sick children. And then, of course, even within the hospitals, have algorithms that can be able to risk stratify mothers during antenatal clinics. Maternal nutrition has been mentioned by my colleague from the Gates Foundation. But at the same time, we do need to develop best practices for preterm care. There's a lot more on that particular list. It's available, but we are looking forward to working with Grand Challenges Nigeria in making sure that the request for proposal that will be unveiled today is actually responding to the needs of Nigeria in the area of maternal and neonatal child health.
Thank you. Indeed, what you have shared with us will go a long way to shape some of the innovations that we will be looking at here in Nigeria through the Grand Challenges. You've really given us a snapshot of your wide experience in the area of maternal and child health innovations across Africa, and particularly West Africa. Thank you for that. I'll quickly go to Mr. Adebayo, and I want to express our profound gratitude to the Federal Ministry of Innovation, Science and Technology for immediately aligning with the Grand Challenges vision in Nigeria. So I know you've been championing a lot of science and technology innovations in the country for some time. I would like to ask you, what are those key technological advancements that you're currently working on? And perhaps you can give us some idea on how to scale these up at the national level. Thank you.
Thank you very much for the question. And we are the Ministry of Innovation, Science and Tech, very glad to be here and to continue working together with all the everyone. For the Ministry of Innovation, Science and Tech, just like you said, in Nigeria, over time, we've been working, we've championed some innovation, especially that can address child and maternal health, okay, in Nigeria, especially from the perspective of innovators and also giving opportunity for indigenous innovation that can, address some of these challenges locally. Sometimes it's reasonable when you want to have a solution that is domain specific. And sometimes you want to make sure that whatever solution that you're providing or you are trying to create, it tries to think about the economy of the nation. So to that effect, Ministry of Innovation, Science and Tech, not too long ago, we've been able to develop and establish a telemedicine platform. This actually referring to an re-engineering of a mobile clinic that leverage telemedicine. And this was done by the role of an agency of the ministry that is a National Agency for Space Research and Development. And this device is able to solve a problem of bringing hospital to the unreached. So, but we're not doing this particularly alone. This is done in collaboration with Federal Ministry of Health. And these buses that was actually created have been deployed and through the, the services, hospital services of the Federal Ministry of Health and Social Development. So that is one. But when we're talking of innovation, we're always talking of something that is inclusive and that can be scaled, just scalable. We know that the kind of project that was done, sometimes it could be a tall order for many governments. And for the government to be able to replicate that, it might take some time, a bit of a budget. So apart from having that deployed, the ministry also explore innovation from innovators. Now, we've been in collaboration with other, non-governmental agencies, like this Social Initiative for Social Innovation for Health Initiative, CAI. And through the activity of this collaboration, we'll be able to identify Nigerians, especially, I like to say indigenous innovation, that have solutions, apps, and that have been able to scale down this technology, telemedicine technology, to something that could be used almost informally and without necessarily having so much capacity to deploy it. So we've been able to identify two, particularly that the ministry is working on, and especially a video teleconferencing, device where the ministry is looking up to scale, maybe in the nearest future. Okay, so let me just go ahead to answer the aspect of what are the opportunities there to scale this innovation that we're able to do. Government is on its own, particularly has to play the role of putting the right, incentives for innovators to be able to, scale or to be able to make use of their innovation, and we can use their innovation for national, development. So the areas that we're looking is when these innovators and their simple innovation, government looking for opportunities like we're going to have now with Grand Challenge, to be able to see how we can scale, the solutions that they have provided and see how this can be deployed in high levels to solve national health problems. But definitely, the innovation is not only on health, other areas, many other development areas. Thank you.
Thank you very much, Mr. Adebayo Adeyemi. Without doubt, we are properly positioned to be anchored within the Federal Ministry of Science and Technology.
Absolutely.
Thank you for sharing the collaborative nature of your ministry with us in terms of innovative ideas and in terms of scaling. I think, Chimdi, you're ready for me?
Yes. Professor Sonny, We all know about the current food insecurity and malnutrition issues within the country, but we also know that your organization is working to promote sustainable agricultural practices. How can the sustainable practices be used to achieve dietary diversity and also address food insecurity issues, as well as ensure that there are practical and scalable models that can be widely adopted across the country?
All right, thank you very much for this opportunity. We all know that Nigeria is an agrarian community, and we have natural and abundant resources. Number one issues in sustainable dietary practices is for us to strengthen our crop, livestock, and forest diversification. When we were young, most of the functional foods that assisted some of us, including my mama here, are no more. And this is very critical that I want us to look at. The avocados of this world, the yeye of this world, agbaluma, you know, these are some of the diversifications that we need to face in this challenge program. The second point is nutrient-dense foods from locally available commodities. Locally available commodities. We call them underutilized crops. People do not know the power of Bambara nut, you know, and that's the second point that we have looked at. We started the issue of school feeding program, but the way the school feeding program is, need to be restructured to be able to accommodate some of the things that were given to us to grow. If you want nutrient strong community, you must eat what you are producing. As an institute, Nigerian Stock Product Research Institute was established in 1948 by the British government and served the East Coast, Ghana, Togo, and over the years, the UK government strengthened that institute such that it is not possible that you will export any aflatoxin contaminated groundnut out of Nigeria or Ghana or Togo. Talk less that EU is banning our cowpea. Whereas our institute has technology that solves those problems. Non-chemical, no side effect. His Excellency, the Executive Governor of Borno State recently ordered for 1,000 metric drums from my institute now. We have delivered them. The drum treated is less than 100,000 naira. In fact, it's less than 80,000 naira. People are not aware. 2, the Sasakawa African Association, strengthening communities in the north now, in Kano, for instance, order for 210 of that metric drum to replace the Purdue pigs bags that can easily be damaged after use. International Institute of Food Policy Research, IFPRI, in Washington, now commissioned my institute. We have installed 10 parabolic dryers in Kano for rural vegetable producers that will be able to produce nutrient-retained, dried horticultures for the infants. So the point I'm saying is that, number one, we need to promote and re-engineer the diversification of our crop, livestock, and forestry. Number two, we need to strengthen the food fortification strategy that we started long time ago. Soya bean, Dr. Our mentor, our leader is here, Yinka Onabolu. She's seated here. With IDLC supported funding, and Kendashi and all of them in this country, they promoted the use of soya bean. And I'm including Bambara nut now. And if you are talking of complementary foods, these are some of the major critical ingredients that you need to use. The last point is the issue of bao maize that we have and bao cassava that we are promoting. the vehicle of some of those commodities we are promoting are not being well adopted because we are not actually asking people what do they want to use those bulk crops for. These are another interventions that I think we can also promote. And lastly, we have small cottage innovative post-harvest technology that need to be promoted. Thank you.
Thank you so much. And it's really exciting to hear about the crop diversification you're doing, especially for the foods that we grew up with. So really looking forward to that, but also quite concerning to hear about the lack of widespread awareness of a lot of the innovative solutions that we have in the country to address some of these issues. With an eye on time, given that we're running a bit over, so we'll not take the second round of questions. What we're going to do now is ask for parting words from each of the panelists for the Grand Challenges Nigeria. We'll be starting with you, Dr. Ame.
Yeah, so I think it's actually a great initiative for Nigeria, looking at how we can be innovative in how we think about healthcare delivery, how we think about solving the different problems in our health space. I love that we're actually thinking about collaboration in this space, right? And this is great because looking at where the world is going to, we need to be quite innovative with the way that we do healthcare delivery, the way we think about the solutions to different health problems that we have in Nigeria, and the way we look at executing different projects that we're looking at. It is great, again, that we can have funding for the different things that we're looking at, and we have governments collaborating with different stakeholders to make this happen. I believe that there are lots that we can do in Nigeria with technology, with the brilliant minds that we have, even on the panel and everybody in the room. What I would advocate for is that we keep, putting our strategies forward. Think of different ways we can do innovation. And when we do innovation, think of the end users first. Because, again, I'll say this again, we don't want to build anything or put initiative out there that we build, take pictures, and then, it can't scale. Scalability is actually really important. It is best that whatever we build it for the end user and it's best fit for them. And when we build these things, we should follow up to make sure that these things are scalable, they are working the way they should, and they give the effect that we have. And as we look at the different opportunities that will come with Grand Challenges already, I just hope that we have or give the best possible effects on the Nigerian lives, looking at those in the sub-regions especially, all the way to the top, yes? And then we can give Nigeria a better life in the years to come.
Thank you very much, Dr. Ame. Mr. Ikanem, parting words from you.
Yes, so I just wanted to say that the first thing is the primary healthcare system in Nigeria is an essential bedrock of our development. 6 out of 10 Nigerians lack access to essential primary healthcare. And secondly, if you look at even going to Prof's comment about food fortification, just because of the fact that we're not really pushing that as a strong priority, about 840,000 children under 5 die because of deficiency around malnutrition. So this is something that is really important. So what we're employing is, one, look into the solution around MMS, which is a multiple micronutrients system. Number 2, look into vitamin A. Vitamin A also as another supplement for children. We are advocating that it should be given twice a year to children in terms of just to help them out with general welfare. And the third thing we're also saying is bullion fortification. So in other words, bullion, for those who don't know, is just your Maggi cubes. But imagine adding things like iron, folic acid, zinc, vitamin B12 into that Maggi cube. You find out that it goes a long way than just the regular Maggi cube that we look at. So bullion fortification is important. The fourth thing I would say is partnerships. I think what we're doing here at Grand Challenges is really around how do we forge partnerships together, right, with the ministry here and different ministries here. And then the last thing I would say is really we definitely have to look into how do we scale more innovative solutions. the fiscal space in Nigeria is quite tight. So it's forcing us to really rethink how do we begin to even budget or spend our money efficiently. So what we're advocating for is let's begin to look at the fiscal space generally across the federal level, state level, all the way down to LGA level, and really prioritize spending at those particular levels and really focus spending on what is really important. We've talked about, for us in the foundation, we look at large-scale food fortification. So how do we drive that? So we're asking different arms of government to begin to look at food fortification. We're asking them to also continue the swap process, the 774 initiative that the federal government is carrying out. All these different ventures are just different initiatives that we can do. But at the end of the day, we must have an integrated approach to solve our most pressing issues. Thank you.
Thank you very much, Mr. Ekanem. I'll come to you now, Mr. Adebayo.
All right, thank you very much. I'd like to encourage everyone, all the stakeholders seated here and those with us online. Please, everyone, you got to look again, take an opportunity again, take a second look at the National Science, Technology and Innovation Policy 2022. It's a revised version. That policy is the thing that government have put in place to allow and promote collaboration. You know, we're talking of innovation here, every silos of innovation. All these innovation will can only come to light and bring the expected result that we anticipate when we're able to collaborate. Now, this is what government have put in place. It is not just a policy for the ministry, but it is also a guideline for collaboration. Government have put this in place such that it can engender the collaboration that we require so that all the individual efforts can come together and bring out a fruit that we desire. This is very key to forging ahead and making Nigeria, our nation, and even globally moving forward. Thank you very much.
Thank you very much, sir.
Thank you. Professor Sani?
All right, thank you very much. I think we've talked about partnership, networking, and collaboration is key. Second point is we need to have available, documentable, user-friendly innovations that could be able to assist us in driving this current nutrition challenge that we have. And the last point is capacity building. Capacity building not only with the public sectors, but capacity building with the private sectors and key actors that will be able to mainstream the scaling of whatever solutions that we have. Thank you very much.
Thank you so much. Professor Akinwale?
Thank you very much. Like I said earlier, that infection detection in Nigeria faces many challenges, among which is early detection. And Nigerian Institute of Medical Research, which I'm representing, has tried to bridge this gap by coming up with the products that our innovators developed. The ones for COVID, the CIMA, the SCODA, and currently we have those ones for Lassa fever, yellow fever, monkeypox, hepatitis B, and currently we are developing the one for cholera, which needs no expertise or specialized equipment and will be deployed to rural areas and rural health centers. But I will encourage the government to ensure that there are policies for the adoption of these innovations, these indigenous innovations. For example, we all know that Nigerians love foreign products. We prefer made in England, made in US to made in Nigeria. But I can tell you that all these products that NIMA came up with, like I told you, that they can compete with the foreign counterparts in the area of sensitivity, specificity, affordability, accessibility. We are here in Nigeria, you purchase in Naira, and we are everywhere, like I said earlier. And then we need collaboration among health agencies and organizations in Nigeria. For example, the NCDC, the Nigerian Center for Disease Control and Prevention, can come up with diseases that we need surveillance and detection kits for. Even our teaching hospitals also. So NIMA can leverage government funding and some external fundings that we have to come up with innovative ideas and develop kits in addition to those ones that we have developed. And also we need local funding to encourage and to assist our innovators. We have vibrant, young, able and determined researchers in NIMA, and they are coming up with ideas, innovative ideas. They are coming up with products, but we are faced with challenges, among which is the local funding. We need more funding from governments because, yes, we get external funding, but we know that these funding organizations, they have their research agendas, they have their focus areas, they dictate the tunes because they pay the piper. So if we have our local fundings, we are ready to take up the challenges and assist in improving the health of Nigerians, especially the rural areas.
Thank you, Professor Kanwali. Dr. Moses Alobo.
Yeah, thanks again. So for us as Science for Africa Foundation and Grand Challenges Africa, we reiterate our commitment to supporting Grand Challenges Nigeria. It's important for me to mention at this particular point that it is a formidable group of countries that are now coming together for ensuring that we are unlocking domestic funding, as Professor has just said, for our scientists. At the moment, we already have Grand Challenges South Africa, we have Grand Challenges Botswana, Grand Challenges Malawi, Grand Challenges Ethiopia, Grand Challenges Rwanda, and Grand Challenges Senegal. And of course, today we are absolutely excited to be launching Grand Challenges Nigeria. We believe that when our own countries come together as program managers thinking about innovations and the development of science, we will get to a place where we co-design requests for proposals that respond to African issues, African priorities, and then of course also unlock government funding for our own researchers and ensure that we are using the knowledge management economy to actually progress and contribute towards country building and economic building. So we look forward to the success of Grand Challenges Nigeria, and we look forward to working with Grand Challenges Nigeria in this particular aspect. So thanks again for having us in your panel.
Thank you. I have heard recurring themes around being end-user centric, indigenous solutions, partnership and collaboration, scalability. Professor Samuel?
Knowledge management economy, promoting homemade solutions, PHC focused, leveraging existing solutions, prioritizing spending, hope, success, encouragement. We've heard all those words. And so we are really happy and grateful to this panel for all what we've heard today. You've really given us an insight into how we should be thinking about innovation in Grand Challenges Nigeria. And we're really happy to have heard commitment in all that you've said. You're all from different sectors. You're from government, from non-government. GC Africa is here. And all we can hear is support. Support and commitment to this nascent Grand Challenges program. We are really inspired. And we want to say that on the strength of this, we will make a success of Grand Challenges Nigeria. And over the next decade and beyond, we will work with the government of Nigeria, with esteemed partners, whom we gratefully acknowledge. I would like to mention some other partners beyond those of us here on the panel. I would like to thank Dalberg Global Development Advisory, NISPRI, NIMA, the Aliko Dangote Foundation, Alive and Thrive FHI 360, and others who will join us later to create meaningful improvements in the lives of Nigerians across health, food systems, and development. Once again, we want to say thank you very much to our dear distinguished panelists and our listeners, both here and online. Thank you very much.
Thank you.
think you'll stand around for a group photograph. Do we have the official photographer here, please? Thank you. Thank you very much for the issues, and of course, hopefully the recommendations that are made, which I just jotted some points down here: strengthening food fortification and diversification. I think that's very important. Advocate for more innovative solution, integrated approach to solve issues around food security, collaborative partnership between government and other key food producers to improve food production. Yes, thank you so very much. The moderators have done so well. Of course, I like the fact that there's a continental switch to it, collective efforts among critical stakeholders in Africa to promote food security and promoting homemade solutions. Very, very important, because that leads us to sustainability. Again, let's put our hands together for the panel. During the course of that panel discussion, we had with us Honorable Chike Okafor, Chairman, House Committee on Nutrition and Food Security, who came in. Honorable, thank you so much for being part of this. Also, Major General Ahmed Tijani Jibril, representative of the Honorable Minister of Defense, is also with us. You're welcome, sir. And also Dr. Bola Oyiledu, Principal Investigator and Chief Executive Officer, Center for Integrated Health Programs, is also here with us. You're welcome. We are moving on steadily, as I think we'll have a short break before we go to, we can go to the gallery to my extreme left, where you can also see some projects of grand challenges that they have embarked upon. I think there's a pictorial there that have been mounted up that we can all go to. To the dome, that is extreme left, the ushers would please direct you. We'll have about 10 minutes to do that quickly, and then we'll come back here so that we can have the official launch and other announcements. Thank you very much. Please, can we do that quickly? Can the ushers please be present to lead our guests to the adjoining hall, where there's an exhibition there. I mean, where you had your tea. So if you want a refreshment or something, you can quickly grab that and be back in the hall in the next 7 minutes, counting from now. Thank you.
Sound check.
Childhood diarrhea actually has been a problem for decades, centuries. The good news is that in the last few decades, the prevalence of the incidence of diarrhea deaths have actually gone down. And so that's a really positive thing. So we're interested in how bacteria make children sick, but we're also interested in coming up with solutions so that diarrhea bouts will be less devastating on the children that are sick. And so the Grand Challenge project that we have is actually focused on drug discovery. And the idea is that we can use the knowledge that we're getting out of surveillance and understanding how bacteria make people sick to start to discover solutions that could be used to treat children who have these infections. So what the Grand Challenges Africa program has allowed us to do is to start a drug discovery arm of our research, which is actually very interesting and very exciting. But on the other hand, it's really important for us to start to develop our own drugs. And drug discovery, it's not just the doing to discover a particular drug that's important. The process and being sure that people who are engaged in science actually are gaining the skills that allows them to develop drugs is actually really important. Well, I think it's really important to bring all good minds to address all important problems. And unfortunately, on the African continent, this is least likely to happen. We have a lot of smart people, we have a lot of problems, but making that connection is difficult because solving problems is actually quite expensive. Many of our countries are not contributing enough to research, and so it's really important, first of all, to be able to get the resources to the people who could address those problems. Secondly, when you have an organization that is actually built around developing research. It creates research communities. And so, for example, I know the other people in Africa who are working on drug discovery. I can work with them, I can learn from them, I can talk to them, and that community was essentially built out of the Grand Challenges program. Each generation discovers more than the generation before it. So if you're just getting into science now and you're really impressed with what has gone on before, once you're committed, you can be sure that you're going to make even more important discoveries. I think it's important to have that at the back of your mind, because sometimes the day-to-day work can be very tedious. But scientists should be aware of the fact that today we have tools that we didn't have a decade ago. And so there's a greater opportunity for discovery. My name is Iruka Okeke. I'm a professor at the University of Ibadan in Nigeria. I'm a bacteriologist. That means I study bacteria. Bacteria are germs that cause a range of diseases. I'm particularly interested in diarrhea that occurs in very young children, which can be potentially fatal, and in bloodstream infections. So we study the bacteria to find out how they make people sick. We also study the bacteria to find out how they become resistant to antibiotics. Childhood diarrhea actually has been a problem for decades, centuries. The good news is that in the last few decades, the prevalence of the incidence of diarrhea, deaths have actually gone down. And so that's a really positive thing. So we're interested in how bacteria make children sick, but we're also interested in coming up with solutions so that diarrhea bouts will be less devastating on the children that are sick. And so the Grand Challenge project that we have is actually focused on drug discovery. And the idea is that we can use the knowledge that we're getting out of surveillance and understanding how bacteria make people sick to start to discover solutions that could be used to treat children who have these infections. So what the Grand Challenges Africa program has allowed us to do is to start a drug discovery arm of our research, which is actually very interesting and very exciting. But on the other hand, it's really important for us to start to develop our own drugs. And drug discovery, it's not just the doing to discover a particular drug that's important. The process and being sure that people who are engaged in science actually are gaining the skills that allows them to develop drugs is actually really important. Well, I think it's really important to bring all good minds to address all important problems. And unfortunately, on the African continent, this is least likely to happen. We have a lot of smart people, we have a lot of problems, but making that connection is difficult because solving problems is actually quite expensive. Many of our countries are not contributing enough to research, and so it's really important, first of all, to be able to get the resources to the people who could address those problems. Secondly, when you have an organization that is actually built around developing research, it creates research communities. And so, for example, I know the other people in Africa who are working on drug discovery. I can work with them, I can learn from them, I can talk to them, and that community was essentially built out of the Grand Challenges program. Each generation discovers more than the generation before it. So if you're just getting into science now and you're really impressed with what has gone on before, once you're committed, you can be sure that you're going to make even more important discoveries. I think it's important to have that at the back of your mind because sometimes the day-to-day work can be very tedious. But scientists should be aware of the fact that today we have tools that we didn't have a decade ago. And so there's a greater opportunity for discovery.
The world is facing many grand challenges: global health inequities, humanitarian needs of people in regions of conflict, and the need for solutions that enable inclusive growth and health of indigenous peoples. There are many known solutions that are making important progress, but the world's most pressing challenges also need innovation. Since 2010, Grand Challenges Canada has been empowering innovators to test their ideas and transform today's barriers into tomorrow's opportunities. We bring together leading global experts, innovators, and those who are living with these barriers to identify the most pressing challenges. We leverage funding from the Government of Canada as well as the public, private, and philanthropic sectors to multiply the impact of every dollar invested. We work with people from these contexts and others to select innovations for seed funding through a rigorous, transparent, and independent peer review process. We take on and manage innovation risk in ways that allow innovators to test new ideas and to learn from the failures and successes. We provide innovators with a range of tailored supports, including access to a broad network of innovation partners and mentors to accelerate impact. We measure everything we do against meaningful metrics, most importantly, lives saved and improved. Grand Challenges Canada is a part of a global network of partners, advisors, and investors who are working towards a common goal. How do you solve grand challenges and change the world? By investing in innovations that, with the right mix of funding and supports, scale to collectively save and improve the lives of millions of people.
And a bi-directional relationship actually do exist between the two. Now, indoor air pollution occurs from different sources, but importantly now, climate change is exacerbating it. So we are making use of a common house plant that is genetically modified so as to enable it to absorb and degrade common indoor pollutants, volatile organic compounds, and the ultrafine particulate matter. And also, this innovation has an advantage of increasing the oxygen content in the home environment, because when it is modified, the plant is taken into an overdrive, and when plants are working, they release oxygen into the atmosphere. So we're measuring those qualities over this period where we're implementing it, and as well as markers like nitric oxide, lung function test, and then looking at the respiratory symptoms. It's a very simple innovation, but also very complex innovation. Simple because it's very simple to use. It doesn't need any technical know-how. It is cost-free for the end users, but it is complex because a lot of science is embedded in it.
One of the challenges for governments and policymakers globally is ensuring equitable access to health services. And this is quite crucial for achieving the universal health coverage, one of the Sustainable Development Goals. And this is particularly problematic for populations in rural, remote areas. One of the main obstacles to achieving access to equitable healthcare is the global shortage of health workforce. Health workforce that are skilled but also motivated are in short supply, especially in rural areas. Unfortunately, for remote rural locations, that's where we tend to have the highest disease burden, and the population also tend to be poorer. A study by the World Bank showed that only 25% of people attending hospitals in Nigeria get the correct diagnosis, and out of this, only 30% get correct treatment. There is a lot of waste of medicine, because when the attending health worker is unsure, they tend to overprescribe. This is dangerous and expensive for the patients, but it is also contributing to the worldwide problem of drug resistance, especially antibiotic resistance. eLikita is a simple, supportive, accessible platform that helps health workers that are located in remote rural areas to be able to approach patients in the correct way, ask the right questions, conduct the correct examination, and request the right tests so that they can arrive at the correct diagnosis, so what is called clinical decision support. It also links them up with a network of professionals globally who can also support them in areas where they're having difficulties. eLikita has been developed and is being tested at Dechi Health Trust Fund Clinic, which is located in Gembu in Taraba State. Once this test has been done successfully, the aim is to actually deploy this software more widely across low-middle income countries in Nigeria, but also beyond. My research looks at how health systems work in settings where accountability systems are weak. So my research looks at how do you make health system work better in that kind of environment. And one way that you can do that is through a more bottom-up approach. A bottom-up approach is where you work with the community themselves as an asset and then look at what are the things that are already working for them and build from there upward to make it even more efficient than it is. An alternative way of strengthening health system is also the top-down approach. And in this case, e-Likita can be useful to the key gatekeepers of our primary healthcare system, like the chief executives of primary healthcare development agencies across the 36 states or the health financing authorities. If they adopt this kind of software, it is going to help speed up the process of quality diagnosis reaching populations. Our plan is to see e-Likita deployed across the primary healthcare landscape in Nigeria, where it will be improving access to quality health services for the teeming rural population. But we are looking beyond that. We believe e-Likita can be applied in many other settings across low-middle income countries, where it will be improving access to quality health services for our population and helping this move towards universal health coverage.
Grand Challenges Africa is an innovations platform that is seated within the Science for Africa Foundation. And here we work with scientists on the African continent with big, bold ideas that focus on the development of the African continent through science, really focusing on science to impact as one of the main things that we are going after. Over the last 7 years of the existence of Grand Challenges Africa, we've had some amazing outputs coming out of the program. We have worked with just about 110 grantees in 27 countries on the African continent. At the same time, Grand Challenges Africa programs over the last 7 years managed to create just about 1,491 jobs. The work that we are most proud of is the drug discovery work, because when we entered into this particular area, we knew that it was a niche area with very few scientists working. But for us, more importantly, is that we were able to support 2 cohorts of 8 each, making it a total of 16. And through partnership with H3D in University of Cape Town, and also the Bill and Melinda Gates Foundation and MMV, we were able to take these particular scientists, support them and have them go through their experiments to the extent that we can now see that there's been a development of this particular science. We are proud of the network that has been formed within the African continent. Indigenous financing and domestic financing will be unlocked if scientists on the African continent can focus on citizens' needs. Then we need to demonstrate to our governments that there is a focus on local priorities for them to keep investing in our own scientists on the continent. So for us, our work is to do as much as possible to de-risk the innovation ecosystem for as many groups as possible. Therefore, our work within Grand Challenges Africa is to make sure that scientists on the continent have the innovation mindset, have the support that they need if they were to build an innovation, and then make sure that members of the innovation ecosystem are also connected to each other to the extent that there's a ready engine for a scientist to actually come up with a new innovation, build it up, and progress it to market.
we, as Grand Challenges Africa, want to have this particular engine ready and available for any scientist on the African continent interested in doing this kind of thing.
My name is Iruka Okeke. I'm a professor at the University of Ibadan in Nigeria. I'm a bacteriologist. That means I study bacteria. Bacteria are germs that cause a range of diseases. I'm particularly interested in diarrhea that occurs in very young children, which can be potentially fatal, and in bloodstream infections. So we study the bacteria to find out how they make people sick. We also study the bacteria to find out how they become resistant to antibiotics. Childhood diarrhea actually has been a problem for decades, centuries. The good news is that in the last few decades, the prevalence of the incidence of diarrhea deaths have actually gone down. And so that's a really positive thing. So we're interested in how bacteria make children sick, but we're also interested in coming up with solutions so that diarrhea bouts will be less devastating on the children that are sick. And so the Grand Challenge project that we have is actually focused on drug discovery. And the idea is that we can use the knowledge that we're getting out of surveillance and understanding how bacteria make people sick to start to discover solutions that could be used to treat children who have these infections. So what the Grand Challenges Africa program has allowed us to do is to start a drug discovery arm of our research, which is actually very interesting and very exciting. But on the other hand, it's really important for us to start to develop our own drugs. And drug discovery, it's not just the doing to discover a particular drug that's important. The process and being sure that people who are engaged in science actually are gaining the skills that allows them to develop drugs is actually really important. Well, I think it's really important to bring all good minds to address all important problems. And unfortunately, on the African continent, this is least likely to happen. We have a lot of smart people, we have a lot of problems, but making that connection is difficult because solving problems is actually quite expensive. Many of our countries are not contributing enough to research, and so it's really important, first of all, to be able to get the resources to the people who could address those problems. Secondly, when you have an organization that is actually built around developing research, it creates research communities. And so, for example, I know the other people in Africa who are working on drug discovery. I can work with them, I can learn from them, I can talk to them, and that community was essentially built out of the Grand Challenges program. Each generation discovers more than the generation before it. So if you're just getting into science now and you're really impressed with what has gone on before, once you're committed, you can be sure that you're going to make even more important discoveries. I think it's important to have that at the back of your mind because sometimes the day-to-day work can be very tedious. But scientists should be aware of the fact that today we have tools that we didn't have a decade ago. And so there's a greater opportunity for discovery.
The world is facing many grand challenges: global health inequities, humanitarian needs of people in regions of conflict, and the need for solutions that enable inclusive growth and health of indigenous peoples. There are many known solutions that are making important progress, but the world's most pressing challenges also need innovation. Since 2010, Grand Challenges Canada has been empowering innovators to test their ideas and transform today's barriers into tomorrow's opportunities. We bring together leading global experts, innovators, and those who are living with these barriers to identify the most pressing challenges. We leverage funding from the Government of Canada as well as the public, private, and philanthropic sectors to multiply the impact of every dollar invested. We work with people from these contexts and others to select innovations for seed funding through a rigorous, transparent, and independent peer review process. We take on and manage innovation risk in ways that allow innovators to test new ideas and to learn from the failures and successes. We provide innovators with a range of tailored supports, including access to a broad network of innovation partners and mentors to accelerate impact. We measure everything we do against meaningful metrics, most importantly, lives saved and improved. Grand Challenges Canada is a part of a global network of partners, advisors, and investors who are working towards a common goal. How do you solve grand challenges and change the world? By investing in innovations that, with the right mix of funding and supports, scale to collectively save and improve the lives of millions of people.
The problem I'm trying to address is actually a silent killer. This is actually the problem of indoor air pollution, which has now been exacerbated with the climate change. And a bi-directional relationship actually do exist between the two. Now, indoor air pollution occurs from different sources, but importantly now, climate change is exacerbating it. So we are making use of a common house plant that is genetically modified so as to enable it to absorb and degrade common indoor pollutants, volatile organic compounds, and the ultra-fine particulate matter. And also, this innovation has an advantage of increasing the oxygen content in the home environment, because when it is modified, the plant is taken into an overdrive, and when plants are working, they release oxygen into the atmosphere. So we are measuring those qualities over this period when we're implementing it, and as well as markers like nitric oxide, lung function test, and then looking at the respiratory symptoms. It's a very simple innovation, but also very complex innovation. Simple because it's very simple to use. It doesn't need any technical know-how. It is cost-free for the end users, but it is complex because a lot of science is embedded in it.
One of the challenges for governments and policymakers globally is ensuring equitable access to health services. And this is quite crucial for achieving the universal health coverage, one of the Sustainable Development Goals. And this is particularly problematic for populations in rural, remote areas. One of the main obstacles to achieving access to equitable healthcare is the global shortage of health workforce. Health workforce that are skilled but also motivated are in short supply, especially in rural areas. Unfortunately, for remote rural locations, that's where we tend to have the highest disease burden, and the population also tend to be poorer. A study by the World Bank showed that only 25% of people attending hospitals in Nigeria get the correct diagnosis, and out of this, only 30% get correct treatment. There is a lot of waste of medicine because when the attending health worker is unsure, they tend to overprescribe. This is dangerous and expensive for the patients, but it is also contributing to the worldwide problem of drug resistance, especially antibiotic resistance. eLikita is a simple, supportive, accessible platform that helps health workers that are located in remote rural areas to be able to approach patients in the correct way, ask the right questions, conduct the correct examination, and request the right tests so that they can arrive at the correct diagnosis, so what is called clinical decision support. It also links them up with a network of professionals globally who can also support them in areas where they're having difficulties. eLikita has been developed and is being tested at Dechi Health Trust Fund Clinic, which is located in Gembu in Taraba State. Once this test has been done successfully, the aim is to actually deploy this software more widely across low middle income countries in Nigeria, but also beyond. My research looks at how health systems work in settings where accountability systems are weak. So my research looks at how do you make health system work better in that kind of environment. And one way that you can do that is through a more bottom-up approach. A bottom-up approach is where you work with the community themselves as an asset and then look at what are the things that are already working for them and build from there upward to make it even more efficient than it is. An alternative way of strengthening health system is also the top-down approach. And in this case, e-Likita can be useful to the key gatekeepers of our primary healthcare system, like the chief executives of primary healthcare development agencies across the 36 states or the health financing authorities. If they adopt this kind of software, it is going to help speed up the process of quality diagnosis reaching populations. Our plan is to see e-Likita deployed across the primary healthcare landscape in Nigeria, where it will be improving access to quality health services for the teeming rural population. But we are looking beyond that. We believe e-Likita can be applied in many other settings across low-middle income countries, where it will be improving access to quality health services for our population and helping this move towards universal health coverage.
Grand Challenges Africa is an innovations platform that is seated within the Science for Africa Foundation. And here we work with scientists on the African continent with big, bold ideas that focus on the development of the African continent through science, really focusing on science to impact as one of the main things that we are going after. Over the last 7 years of the existence of Grand Challenges Africa, we've had some amazing outputs coming out of the program. We have worked with just about 110 grantees in 27 countries on the African continent. At the same time, Grand Challenges Africa programs over the last 7 years managed to create just about 1,491 jobs. The work that we are most proud of is the drug discovery work, because when we entered into this particular area, we knew that it was a niche area with very few scientists working. But for us, more importantly, is that we were able to support 2 cohorts of 8 each, making it a total of 16. And through partnership with H3D in University of Cape Town, and also the Bill and Melinda Gates Foundation and MMV, we were able to take these particular scientists, support them and have them go through their experiments to the extent that we can now see that there's been a development of this particular science. We are proud of the network that has been formed within the African continent. Indigenous financing and domestic financing will be unlocked if scientists on the African continent can focus on citizens' needs. Then we need to demonstrate to our governments that there is a focus on local priorities for them to keep investing in our own scientists on the continent. So for us, our work is to do as much as possible to de-risk the innovation ecosystem for as many groups as possible. Therefore, our work within Grand Challenges Africa is to make sure that scientists on the continent have the innovation mindset, have the support that they need if they were to build an innovation, and then make sure that members of the innovation ecosystem are also connected to each other to the extent that there's a ready engine for a scientist to actually come up with a new innovation, build it up, and progress it to market. We, as Grand Challenges Africa, want to have this particular engine ready and available for any scientist on the African continent interested in doing this kind of thing.
Again, Your Excellencies, all very distinguished ladies and gentlemen, any moment from now we'll have the grand entrance of the Vice President of the Federal Republic of Nigeria would immediately be upstanding for the national anthem, and thereafter the events will start properly. Yes, can we please all rise as we receive with us His Excellency, the Vice President of the Federal Republic of Nigeria. Can we have the national anthem, please?
Nigeria, we hail thee, our own dear native land. Though tribe and tongue may differ, in brotherhood we stand. Nigerians old and proud to serve our sovereign motherland. Our flag shall be a symbol that truth and justice reign. In peace or battle honored, and this we count as gain. To hang on to our children a banner without stain. O God of all creation, grant this our one request. Help us to build a nation where no man is oppressed, and so with peace and plenty, Nigeria may be blessed.
Thank you. Please be seated. Your Excellency, Senator Kashim Shettima, the Vice President, Federal Republic of Nigeria, Honorable Chike Okafor, Chairman, House Committee on Nutrition and Food Security, alongside with other members of the National Assembly here present, the Honorable Minister of the Federal Ministry of Innovation, Science and Technology, Chief Uche Geoffrey Naji, Your Royal Highnesses, His Highness Muhammad Sanusi II, PhD, Chairman, Board of Trustees of the Nutrition Society of Nigeria, President of the Nutrition Society of Nigeria, Professor Salisu Maiwada Abubakar, Professor Folake Samuel, PhD, Program Director and Technical Lead, Grand Challenges of Nigeria, Honorable Ministers here present and their representatives, other members of the House of Representatives, members and very distinguished special advisors to the Vice President from the Office of the Vice President, Federal Ministry of Innovation, Science and Technology members here present, Grand Challenges Network of Africa and indeed Nigeria. Also would like to mention quickly Professor Hafiz Abubakar, former Deputy Governor, Kano State, Board of Trustees, Nutrition Society of Nigeria, Professor Salisu Abubakar, President, Nutrition Society of Nigeria, Ekanem Isichi, Deputy Director, Policy, Advocacy and Communications, Bill and Melinda Gates Foundation, and then the entire advisory board of Grand Challenges Nigeria. Indeed, a long list, and a long list of partners, which I have here. We have partners from the Nigerian Institute of Medical Research, Nigerian Stored Product Research Institute, Bill and Melinda Gates Foundation, Science for Africa, Aliko Dangote Foundation, Development Research and Project Center, FHI 360, Dalberg Global Advisory, members of the academia, members of the non-governmental organizations, very, very distinguished ladies and gentlemen, and of course, ladies and gentlemen of the vibrant Nigerian media. I'd like to welcome all of us here to this very unique occasion, unique in the sense that it's taking us in to think inside the box, not outside the box, and ensure that creating the future actually requires innovations for a sustainable development, especially in today's world. It makes it to overcome the grand challenges that are trying everyone, globally, Nigeria inclusive. Reimagining the Nigeria we want in spite of ongoing challenges that loom larger than life as we view them in an imperative for development. In this era of technology and, of course, digitalization, it is easier to overcome our challenges when we use what modernity offers, and that's one of the reasons we are here today. Our challenges are not insurmountable when we critically address them. We have to be agile, bold, think in and out of the box. Above it all, we have to be intentional about overcoming our challenges. It is the only way to get us out of the woods of grand challenges. Your Excellency, the Vice President of the Federal Republic of Nigeria, Your Excellencies all, very distinguished ladies and gentlemen, welcome to remaking our locality world without its challenges, and even when they are there, to surmount them. I welcome all of you. My name is Mujima Kojola, and I'm excited to be here today. We've had a wonderful technical session that gives a place of foundation for what we're about to witness today. Nigeria is joining the rest of the world to be part of the grand challenges and to ensure that we have inbuilt, and I want to repeat and emphasize that, inbuilt country response, particularly to food nutrition and the works as we go on today. Welcome, and thank you for being part of history. At this very moment, I'd like to invite to give us an opening remarks, a young woman who is making her impact and who believes in Nigeria, so she is here with us. She's Special Assistant to the President on Public Health, and the spirit moving all of us here today. Please welcome with me Mrs. Uju Anwoka. And that applause is not loud enough. Thank you.
Your Excellency, the Vice President of the Federal Republic of Nigeria, my boss, my teacher, my mentor, Senator Kashim Shettima, GCON, who also combines his office with the chairmanship of the Nutrition Council. Let me use this opportunity, Your Excellency, to appreciate you for your commitment towards tackling the issues of malnutrition in our country, especially through the Nutrition 774 initiative. Your name will be remembered and will go down in history as one who has considered the grassroots and how to tackle this menace. Your Excellencies here present, honorable ministers, particularly the Honorable Minister of Science, Innovation, and Technology, I salute you, sir. The honorable members here present from the Federal House, I salute you. Your Royal Highness, the Chairman, Board of Trustees of the Nutrition Society of Nigeria. And please permit me to stand on existing protocol for want of time. Distinguished ladies and gentlemen, in our world today, nations are grappling with one challenge or the other. In the United States, it's the mass shooting and gun violence. In China, it is the slow post-pandemic recovery with declining exports. In Ukraine, the ongoing war continues to have profound economic and political consequences. This goes to show that every nation, without exception, faces its unique set of challenges. Some embedded in histories, others shaped by evolving realities. Nigeria is no exception to that. But what sets us apart as a nation is not the magnitude of the challenges that we face, but the audacity with which we confront them. Today, we gather to embody that audacity. In our rich culture and the resilience of our people lies a truth. The solutions to Nigeria's challenges cannot be copy-pasted from foreign templates. They must be homegrown, rooted in our values, and powered by our understanding of local realities. What makes us unique as a nation is not just our diversity and resilience, it is the very structure of our strength, deeply rooted in our culture. When we take a look at our country, Nigeria, we are strongest at the family level, even stronger at the community level, but we are stronger at the community level than we are at the local government level, stronger at the local government level than we are at the states level, stronger at the states level than we are at the federal level. This is who we are, and this is why the Grand Challenges Nigeria project is critical. It dares to confront our problems by drawing strength from our unique context, our grassroots voices, and our collective will. Endorsed by His Excellency, the Vice President of the Federal Republic of Nigeria, this initiative aligns seamlessly with the renewed hope agenda under the visionary leadership of His Excellency, the President Bola Ahmed Tinubu. It reflects our shared commitment to reforming our economy, achieving food security, and prioritizing education, health, nutrition, and social investment as pillars of national development. Drawing inspirations from the Nutrition 774 initiative, a flagship program of the National Council on Nutrition, led by His Excellency the Vice President. Similarly, the Grand Challenges Nigeria embraces principle of localized, community-driven strategies designed to meet the unique needs of Nigerians wherever they reside. At the heart of this initiative lies the understanding that life is built on three critical assets: time, knowledge, and financing. These three must work together, and where one is lacking, the other two must compensate. Time demands urgency, financing requires commitment, but it is knowledge, the fuel of research and innovation, that propels us forward. Grand Challenges Nigeria solves for this by fostering a platform where our best minds can connect research to practical, impactful solutions. Through this, we are not just solving today's problems, but we are shaping tomorrow's possibilities. This initiative brings together the government of Nigeria, the Nutrition Society of Nigeria, and a consortium of national and global partners. It is a multi-sectoral coalition that commits funding, expertise, and leadership to seed impactful innovations, scale them up, and amplify their reach. It is dedication of our leaders and the potential of our collective action. Distinguished ladies and gentlemen, the journey ahead will definitely test us, no doubt. But history has shown that when Nigerians unite in purpose, we overcome the impossible. We will harness the power of our grassroots, leverage on the brilliance of our researchers, and commit to a legacy of progress, care, and health for generations to come. Thank you, and God bless you.
Thank you so very much. Another round of applause for her. As a people, as we strive to provide all earths and ensure that food security is secured in Nigeria, I think the watchword is the fact that we can network, we can get it done, even in country. We'll move on now quickly. Malnutrition, particularly amongst Nigerian children, is very visible. Sometimes you see them and you're like, we're not at a war zone, so why should we have this? We're in the midst of plenty, so why should we have malnutrition? But getting it together, getting the right mix together, getting education out there, and ensuring that it works. And I think this is the premise on which the Nutrition Society of Nigeria are working to ensure that we understand the need for healthy eating to grow the healthy herd of Nigerians that will move this country forward. It is on this premise I'd like to invite the president of the Nutrition Society of Nigeria, Professor Salisu Abubakar, who will now give us the welcome remarks. Please, let's welcome him warmly. I think this is his first major assignment since he became president. Congratulations again.
Thank you. Your Excellency, the Vice President of the Federal Republic of Nigeria, Senator Kashim Shettima, GCON, Honorable Minister of Innovation, Science and Technology, and other ministers or their representatives that are here, Honorable Chairman of the House Committee on Nutrition and Food Security, and other members of the House of Representatives that are here, distinguished members of the Global Grand Challenges Network, His Highness the Emir of Kano, and the Chairman of the Board of Trustees of Nutrition Society of Nigeria, Allah Itemeki Sarki, Allah Ijazamanin Sarki. Respected partners of the Grand Challenges Nigeria, members of the Governing and Advisory Board of the Grand Challenges Nigeria, fellows of the Nutrition Society of Nigeria, other members of the society, all other participants that are with us. We are told that there are about 700 participants online with us. We recognize you. Distinguished guests that are here, members of the press, ladies and gentlemen. On behalf of the Nutrition Society of Nigeria, it is my privilege and honor to extend a warm welcome to each and every one of you as we gather today for the official launch of the Grand Challenges Nigeria project. Today marks a significant milestone in our journey as Grand Challenges Nigeria project towards transformative progress in health and sustainable development across the country. The Nutrition Society of Nigeria is deeply, deeply grateful to the federal government of Nigeria, especially to His Excellency, the Vice President of the Federal Republic of Nigeria, for taking ownership and commitment to sustain the Grand Challenges Nigeria project. We are indeed also very much grateful and acknowledge and sincerely appreciate the partners, especially the Federal Ministry of Innovation, Science and Technology, for also being a government anchor for this project. I will not fail to mention our other partners, which has also been mentioned earlier, including the National Institute of Medical Research, Nigeria's Stored Product Research Institute, the FSI 360 Alive and Thrive, the Aliko Dangote Foundation, for their commitment also to join us in getting the Grand Challenges Nigeria to the success land. The Grand Challenges Nigeria project, as mentioned, is poised to address some of our most pressing health and development challenges by cultivating our local innovation and providing targeted support at the areas where it's needed most. The approach that this challenge is using is meant to be the one that to be indigenous, impactful, scalable, sustainable, and locally contextualized. And this aligns perfectly with our nation's aspiration, as mentioned by the previous speaker, to address complex issues that involve a vulnerable population in the society, including women, children, and marginalized communities. Our core objective reflects our dedication to an ecosystem of collaboration and shared learning. And through Grand Challenges Nigeria, we aim to create a robust platform for local researchers, healthcare providers, innovators to develop solutions tailored at Nigeria's unique needs. And the solutions will span through key areas. We are a nutrition society of Nigeria, but the Grand Challenges is covering not only nutrition, it covers all areas of human endeavor that will speak to the development of the country. At the heart of this project is our commitment to ensuring the solutions we develop are inclusive and they are equitable, bringing together different sectors, including the public, the private, the academia, the community as stakeholders, and any other key player that will support the achievement of this goal. Therefore, our efforts will not only advance health outcomes, but build indigenous capacity and forge partnership that will drive sustainable progress. We are therefore very, very excited to embark on this journey together with everyone, and we invite you to join us in advancing the mission of Grand Challenges Nigeria. Let us all work together to foster a culture of innovation and champion the health and well-being of every Nigerian. Your Excellency, distinguished guests and colleagues, we stand united today with a common goal, and that is to make meaningful and lasting impacts on the lives of Nigerians. I am confident that together we can catalyze the change we envision and ensure a healthier, more resilient future for generations to come. I thank you most sincerely, and God bless everyone, and God bless the Federal Republic of Nigeria. Thank you.
Thank you very much, President, Nutrition Society of Nigeria. At this moment, we're moving on to the Goodwill messages. May I please say that the protocol has been established, so you can go straight to your text. But first, we are going to acknowledge that we have contributors from Canada and, of course, Science for Africa. So we'll start with the videos. The videos have been sent in. We're ready with it. We're going to start with the EC Canada, who is also a partner. Yes, thank you. Please come on.
I want to congratulate the team at Grand Challenges Nigeria on your launch today. We're thrilled to have you as part of the Grand Challenges family. Grand Challenges Canada is proud to be an anchor partner in the Global Grand Challenges Network, a group that is all about going further and faster together for impact. With the addition of every country-led Grand Challenge partner who joins us in this work, we're reminded of how critically important it is that the challenges and the solutions to address them are defined by the people who are closest to them. We can't wait to see the innovation that Grand Challenges Nigeria sparks, and we're looking forward to working together.
Straight to the point. We'll now call on Science for Africa.
Nigerian government officials, Grand Challenges Nigeria, dignitaries, ladies and gentlemen. The Science for Africa Foundation extends a hearty congratulations to Grand Challenges Nigeria, the newest member of the Global Grand Challenges Partnerships. Grand Challenges Nigeria became the 7th African country, in addition, for example, to Rwanda, South Africa, Senegal, Botswana, Ethiopia, and Malawi, that have adopted the Grand Challenges model through the support and collaboration with our own Pan-African initiative, Grand Challenges Africa. Our partnership with the Grand Challenges Nigeria will be building upon significant funding and collaboration with various Nigerian institutions. So over the last 3 years, Science for Africa Foundation has funded over 100 researchers in Nigeria to a tune of nearly $3 million across leading academic institutions, including the University of Ibadan, the University of Lagos, University of Nigeria, Redeemers University, and many more. So the creation of Grand Challenges Nigeria is a demonstration of the commitment by the Nigerian government to harness the power of science and innovation to meet local development needs. This move unlocks funding for local innovators to provide local solutions to local challenges that transcend borders and fosters a shared commitment to equitable, impactful change. We look forward to continued collaboration and commitment from the Nigerian government in ensuring a yearly budget allocation to sustain this noble cause. Together, let's continue to support, strengthen, and promote African science for challenges that are solvable through research and development.
Please, a round of applause. We've gone around the continent and gone a bit further globally, showing the importance of what we're here today. We'll continue the Goodwill messages, and in person, I'd like to call Dr. Moses Alobo, Head of Program, Science for Africa Foundation, Grand Challenges Africa.
Your Excellency, the Vice President of the Federal Republic of Nigeria, Your Excellencies, Honorable Ministers, Honorable Members of the Federal House, distinguished guests, fellow ministers and fellow scientists, fellow innovators, good morning. Good morning again. I bring you greetings from the Grand Challenges family, especially Grand Challenges Africa, because it is with honor and excitement that we are attending the launch of Grand Challenges Nigeria, which we believe is a big and bold step towards the utilization of the knowledge and intelligence that is there within the African continent for the development of our region. Nigeria is a nation of immense talent, great resilience, unparalleled opportunity, and we believe that the competitive advantage that Nigeria has is also shown within the African continent, that we do have a very productive land area, we do have a youthful population, immense natural resources, and a highly entrepreneurial spirit. It is therefore our belief that by launching Grand Challenges Nigeria, we can be able to harness the innovation capacity and capabilities that are there within our intellect. Your Excellency, Grand Challenges Nigeria is not just an initiative, but a call to action to every scientist, every entrepreneur, every researcher, every innovator, that from the discussions we've had so far, that the government of Nigeria is interested in what you're doing. And this does not just apply to making regulations and policies, but also demanding for your innovations, purchasing your innovations, and supplying those particular innovations, not just within this region, but beyond the borders. We envision a future where African governments drive the agenda of research in Africa according to our own priorities, looking at the areas of health, climate and environment, agriculture, or any other area requiring technological advancement. Your Excellency, we have learned that nothing is impossible, only that what is usually called impossible only takes time. We believe within the Science for Africa Foundation and Grand Challenges Africa, because of the brilliant minds that we have worked with before here within this soil in Nigeria, who are actually world leaders in their own rights. We have worked with them in the areas of drug discovery, in immunology, in diagnostics, in natural products, Your Excellency, data sciences, maternal and neonatal child health, that a local platform like Grand Challenges Nigeria would enhance their capabilities and ensure their sustainability. As Grand Challenges Africa and through Grand Challenges Nigeria, we reaffirm our commitment to promoting and strengthening science on the continent, our commitment for using science for the economic empowerment, for the health protection, and for agricultural sustainability. May this platform serve as a beacon of progress, a symbol of unity, and a driver of lasting change for generations to come. And for this, Your Excellency, we thank you and congratulate you. Thank you.
Thank you very much, using science to fast track on food security. Perhaps one of the essentials that we need, or pillars that are needed, is ensuring the collaboration of the Ministry of Agriculture and Food Security. And so representing the Honorable Minister, we have Mr. Nuhu Adamu Kilishi, who is the Director of Nutrition and Food Safety. We welcome you most warmly. We're moving on quickly on Goodwill messages. I'd like now to call Mr. Ekanem Isichie, Deputy Director of Policy, Advocacy and Communications, Bill and Melinda Gates Foundation, Nigeria. Let's welcome him very warmly.
Your Excellency, the Vice President, Federal Republic of Nigeria, Honorable Ministers, National Assembly, His Royal Highness, all protocols observed, bring you greetings from the Bill and Melinda Gates Foundation. I think from inception, we've been a pioneer of the grand challenges. And the whole idea was to see how can we begin to think about innovative solutions to solve our most critical problems. So I think we started in about 2003, and to date, we've been part of about 4,000 investments to date, with about 85 of them being here in Nigeria. So we look forward to seeing how the program evolves in Nigeria. The Gates Foundation will see how they can also lend their support in one way or the other. And we do believe that this is a game changer for the time we live in, and especially as we think through all the reforms that the federal government is trying to drive, especially around health, nutrition, through the 774 initiative, to the SWAP approach that the federal government is also looking to do. And also, as Your Excellency, as we discussed with you in person, how we can also address malnutrition in Nigeria. So we look forward to seeing how we can support this program, and we believe that this is the right direction. Thank you.
Our next speaker is one who is sworn on research as an instrument for development, a member of the Nigerian Medical Research Foundation that has raised millions of naira for this country to ensure that we have the critical mass of scientists that we need forging ahead in our beliefs to move on global conventions. He's today chairman, Board of Trustees of the Nutrition Society of Nigeria, Emir of Kano, His Royal Highness Muhammad Sanusi, CON, the second, PhD, London. Please welcome His Royal Highness.
Bismillahirrahmanirrahim. Your Excellency, Senator Kashim Shettima, GCON, Vice President of the Federal Republic and Chairman of the Nutrition Council, the Chairman of the House Committee on Nutrition and Food Security, and other members of the House of Assembly here present, the Honorable Minister of Innovation, Science and Technology, and other ministers and representatives, the President of the Nutrition Society of Nigeria, and members of the Board of Trustees and Council, our partners, please permit me to stand on already established protocols. It is my responsibility to contribute some remarks to the conversation we are having on the occasion for which we are gathered here today. As we celebrate the vision and effort that has gone into the birth of this initiative to fund and advance impactful research and innovation in health and development for Nigerians, the gravity of the problems it hopes to address should also not be too far from our minds. We face sobering health and development realities as Nigerians, and there has been much debate about where the blame for this should lie. With a population of less than 300 million people, we have more poor people than any nation in the world, including China and India, which have more than 1 billion people each. We rank 110th out of 125 countries on the 2024 Global Hunger Index, even worse than some countries at war. The death of our women at childbirth is at a criminally high rate of 1,047 women per 100,000 live births, and we are still losing 107 children before the age of 5 years for every 1,000 live births. Last year, we may have lost an estimated 200,000 people to malaria, and we did not have nearly enough physicians to care for our people even before losing them to the health systems of other countries. And we have not even begun to talk about the effects of hyperinflation, insecurity, or climate event displacements. You know these statistics better than I do. Regardless of where you put the blame, the responsibility for ameliorating these difficult conditions will require both focused effort and collective action. This principle of focused effort and collective action has underlined the framework of grand challenges as a model that has been used since 1900 for solving difficult and intractable global problems, as we may describe what Nigerians currently live through. We have here among us today some of our brightest minds who are doing remarkable work with Grand Challenges funding since 2003 to create better conditions for everyone, thanks to the leadership shown by the Gates Foundation and funding partners from around the world. Some of you are integrating large language AI models to support frontline health workers in low-resource settings and for women-centered care. Others are applying their human genomics expertise to eliminate malaria and bacterial genomics knowledge to create health solutions for people. And several others are focused on strengthening fragile food systems to enable sustainable and nutritious diets for health. More important than each individual research or innovation, though, is that your work is being done as part of a collaborating community of innovators, directing resources and efforts jointly at defined problems. This model is how we win. Until now, the agenda for these challenges has been set by other Grand Challenges programs, and our researchers and innovators have keyed into the global or regional ones. There is nothing wrong with this, and we thank the various Grand Challenges programs for their vision in this regard. What we have here today, however, is a grand challenges for Nigeria that is set to a Nigerian agenda for Nigerian innovators to solve Nigeria's problems. Of course, we do not win in isolation, and the Nigeria project must share with and leverage the knowledge and advances generated by the network of Grand Challenges programs. Yet it is important that we define our priorities ourselves and commit resources to our best minds to them. I would therefore like to thank the federal government of Nigeria and the core organizations that have recognized the opportunity that this framework presents towards innovating solutions to our problems and are supporting the project to define the agenda for innovation investments. I would like to add my voice to Uju to commend the leadership demonstrated by His Excellency, the Vice President of the Federal Republic of Nigeria. As Chairman of the Nutrition Council, and as a committed statesman to the question of nutrition. I would also like to thank the Office of the Honorable Minister of Innovation, Science and Technology, because the leadership they have shown has laid down the example for other MDAs and sector partners to emulate. I should also recognize the foresight of the Nigerian Institute of Medical Research, the Nigerian Stored Products Research Institute, FHI 360, Dalberg Global Development Advisory, and the Aliko Dangote Foundation for their early vision. Let me save my last commendation for the Nutrition Society of Nigeria, which worked to establish the Grand Challenges Secretariat for Nigeria and pulled together the coalition behind it. As the chairperson of your board of trustees, I am proud of the courage that you have shown. Today, we will begin setting our agenda and requesting proposals from our best and brightest minds. I invite you to forge forward by addressing the issues at their hardest to benefit the lives of the greatest number of our citizens. So, despite the realities, congratulations are due all round for the task we have set for ourselves. Thank you, and God bless.
Thank you, Your Royal Highness. The traditional institution in Nigeria has become an imperative to reckon with going forward and going fast. The assurances given and the call for collective action, I'm sure, will be one that will be followed strictly. Thank you again, Your Royal Highness. We're talking about collective action. The legislature is an important and an integral part of it because we really can't go forward without appropriate budgeting and ensuring that the budget works for all of us. Let us please welcome to the microphone Honorable Chike Okafor, who is the Chairman of Nutrition and Food Security at the House of Representatives, for his remarks.
Thank you. Your Excellency, the Vice President of our dear country, Senator Kashim Shettima, GCON, the Honorable Minister for Ministry of Innovation, Science and Technology, and all the ministers here or who are represented, my colleagues, members of the Federal House here present, Your Royal Highness, the Emir of Kano, let me stand on already established protocols. I bring you goodwill from the House of Representatives Committee on Nutrition and Food Security, which is a newly created committee of the House of Representatives, majorly to provide legislative response and address the worsening food crisis and malnutrition in Nigeria. I'm particularly delighted to learn about what the Global Grand Challenges family is doing across the world, creating platforms to drive innovation and solve critical health and development challenges. I believe that launching this laudable initiative in Nigeria now is apt and will help to speedily harness concerted efforts towards discovering solutions to critical problems, and I must commend the Ministry of Science, Technology and Innovation for piloting this agenda. Food availability and good nutrition are very important components of health, which is one of the areas that the Grand Challenges Project tends to achieve. My Committee on Nutrition and Food Security will be glad to collaborate with viable organizations and stakeholders in projects and programs to ensure food security and nutrition, especially among children and pregnant women. Since the creation of this committee just in February this year, we have commenced critical groundworks to achieve our mandate in line with the renewed hope agenda of the present administration. A proposed national summit on nutrition and food security is on the way as mandated by the House of Representatives. And we have opened even more wider our collaborative door to accommodate every genuine stakeholder and concerns. We understand that legislative action both at the federal and state level is key to achieving desired results. Hence, we have concluded our collaborations with the State House of Assembly, who have also, in turn, set up similar committee in the State House of Assembly. I sincerely hope that and pray that as we galvanize these efforts and put machinery in place, we shall together take Nigeria to a new shift of food security, nutrition, health, and desired innovations we earnestly yearn for. Thank you all, and God bless our dear country.
As we continue on the trip, driving innovation for a sustainable future for Nigerians, I thank you, our amiable Vice President, Your Excellencies, all very, very distinguished ladies and gentlemen. At this moment, for the keynote address, I'd like to welcome to the microphone the Honorable Minister of the Federal Ministry of Innovation, Science and Technology, Chief Uche Geoffrey Naji, who I'm sure is a great moment for him today, putting this on the agenda of development for Nigeria.
Thank you, Muji. His Excellency, Senator Kashim Shettima, the Vice President, Federal Republic of Nigeria and Chairman, Nutrition Society of Nigeria, the Chief Honorable Chike Okafor, the Chairman, House of Reps Committee on Nutrition and Food Security, and my brother, Honorable Chema Atu, representing my constituency in the House of Reps, His Highness Mohammed Sanusi II, the Emir of, CON, PhD, the Emir of Kano, and the Chairman of Board of Trustees of Nutrition Society of Nigeria. May I stand on already well-established protocol. Good afternoon, everybody. First, I must extend my deepest gratitude to His Excellency, the Vice President, for gracing us with his presence today. Your support is a testament to the government's unwavering commitment to fostering innovation and development in Nigeria. It is an honor to welcome you to the launch of the Grand Challenges Nigeria project. This initiative is part of the Global Grand Challenge Network aimed at developing local solutions for critical issues in science, health, food systems, and development. It aligns with President Tinubu's 8-point agenda using innovation to drive Nigeria's sustainable growth. In today's rapidly changing world, innovation is essential. Challenges like climate change, food security, healthcare, and technology access require bold and creative solutions. The Federal Ministry of Innovation, Science, and Technology is committed to fostering innovation that is inclusive and sustainable, supporting the President's vision for transformation. To ensure a thriving future, we must create solutions that address current needs while preserving opportunities for future generations. Nigeria's cultural diversity and abundant resources offer a strong foundation for a sustainable and prosperous nation. The Grand Challenges Nigeria project will advance key goals like poverty eradication, education, healthcare, and environmental sustainability, contributing to the United Nations Sustainable Development Goals and our national priorities. This project will unite government, academia, private sector partners, and development organizations. By working together, we can identify key challenges and develop innovative solutions. No single organization can solve these problems alone. Collaboration allows us to combine resources and expertise, delivering strategies with far-reaching benefits. This approach supports President Tinubu's vision of inclusive prosperity and national development. Nigeria is rich in talent, with universities and research institutions full of bright minds. It is our responsibility to nurture these talents and encourage creative thinking. The Grand Challenges Nigeria project will provide opportunities for collaboration, funding and mentorship, empowering researchers and innovators to turn ideas into impactful solutions. Innovation is more than technology. It is about finding new ways to think, collaborate, and solve problems. We must create a culture that values experimentation and resilience, where setbacks are seen as opportunities to grow. Inclusive innovation is vital. Women, youth, and marginalized groups must have a voice in shaping solutions that benefit all Nigerians. Innovation starts with education. By incorporating entrepreneurship and critical thinking into school curricula, we prepare young people for the challenges of tomorrow. Public awareness campaigns will highlight local innovations, inspiring the next generation to contribute to Nigeria's growth. This project is dedicated to breaking down barriers so all Nigerians can participate and shape their future. As we launch this initiative, I urge all stakeholders to join us in this transformative journey. Let us collaborate, nurture talent, and create an environment that fosters innovation. Together, we can support sustainable development and fulfill President Tinubu's agenda for a prosperous and resilient Nigeria. While challenges remain, I am confident that with determination and teamwork, we can make Nigeria a leader in innovation and a model for sustainable growth. Let us seize this moment to inspire every Nigerian and build a legacy of progress for generations to come. Thank you for your commitment and belief in the power of innovation. May God bless the Federal Republic of Nigeria. Thank you all.
Thank you very much, Honorable Minister. I think we need to give him a very, very loud round of applause. as we look forward to a homegrown, sustainable future for Nigerians, particularly with food production, I'd like to invite a man that has given his all to nutrition in Nigeria. As Deputy Governor in Kano State, he was working as well as getting his elective job done to ensure that nutrition is in the development agenda of Nigeria. Today, I'll invite him to please move the vote of thanks. Professor Hafiz Abubakar, who is also member, Board of Trustees, Nutrition Society of Nigeria. Your Excellency.
Your Excellency, the Vice President of the Federal Republic of Nigeria, distinguished Senator Kashim Shettima, the Honorable Minister of Innovation, Science and Technology, and other ministers and all their representatives here present, the Chairman and members of the Board of Trustees of Nutrition Society of Nigeria, His Highness Khalifa Muhammad Sanusi II, CON PhD, Sarkin Kano, that is in Hausa. For those not speaking Hausa, the Emir of Kano, our father, our leader, our mentor, our role model. Allah ya taimaki sarki, Allah ya ƙara wa sarki lafiya, Allah ya ja zamanin sarki. President of the Nutrition Society of Nigeria, members of the governing and advisory boards of the Great Challenge Nigeria Project, distinguished guests, partners, ladies and gentlemen. As we conclude the launch of the Great Challenges Nigeria Project, it is my honor to extend our heartfelt gratitude on behalf of the Board of Trustees of the Nutrition Society of Nigeria. Today, we have taken a vital step towards advancing health, nutrition, development, and sustainable solutions that will positively impact communities across Nigeria for years to come. We extend our deepest appreciation to His Excellency, the Vice President of the Federal Republic of Nigeria, for his invaluable support and commitment to championing innovative solutions for our nation's developmental challenges. Your leadership, Your Excellency, sir, and vision inspire us all to continue working together for a healthier and stronger Nigeria. To our project partners, the government representatives, members of the Nutrition Society of Nigeria, and our colleagues across sectors who have come together for this project, thank you for your invaluable contributions. Your partnership and expertise will be crucial as we embark on this journey, and we are confident that with our combined efforts, the Grand Challenges Nigeria project will create lasting positive change. I would also like to thank all the stakeholders who are here with us today, both in person and virtual. Your presence signifies your commitment to fostering solutions that are scalable, sustainable, and inclusive. Your voices and your ideas will help shape the impact of this project in communities across Nigeria. In closing, let us remember that Grand Challenges Nigeria is more than just a project. It is a promise to our nation. Together, we can achieve the remarkable that is driving transformative change, building a resilient health system, and creating a future where every Nigerian has an opportunity or the opportunity to thrive. Thank you all for joining us today, and we look forward to working alongside each of you to realize the vision of Grand Challenges Nigeria. May our efforts bring us closer to a healthier and more equitable Nigeria. Thank you, and may God bless the Federal Republic of Nigeria.
Thank you so very much. Yes, indeed. Access to nutrition is a right and not a privilege. So let's support all that has been put in place to make this a reality. Since assumption of office, he has shown immense support to ensure that nutrition is given its rightful place. His passion, speaking from the heart, makes this very visible, and that's why he has honored all of us here, indeed honored Nigerians, to be present at this wonderful event that is happening that we sure will change the narratives for where we should be in terms of food security. Your Excellencies, all very distinguished ladies and gentlemen, on behalf of all of you, I'd like now to most respectfully invite His Excellency Vice President of the Federal Republic of Nigeria, Senator Kashim Shettima, GCON, to address us. Your Excellency, sir.
Please kindly sit down, please. The Chairman, House Committee on Nutrition and National Food Security, Right Honorable Deacon Chike John Okapo, Member representing Ehime Mbano, Ihite Uboma, and Obowo Perel constituency of Imo State, and other members of the National Assembly present here, Chief Uche Geoffrey Nnaji, Honorable Minister, Federal Ministry of Innovation, Science and Technology, Selki Mohammed Sanusi II, CON, PhD, Chairman, Board of Trustees, Nigerian Nutrition Society, Oju Banstasia Anwuka, SA to the President on Public Health, and I would like to use her as my point of reference to recognize and appreciate all presidential aides present. Professor Salisu Abubakar, President, Nigerian Nutrition Society, and my brother, Professor Hafiz Abubakar, Member, Board of Trustees, Nutrition Society of Nigeria, members of the Grand Challenges Nigeria family. And I would like to use Ekanem Isishe to recognize and appreciate all our development partners. Distinguished ladies and gentlemen, we are gathered here today with a shared sense of purpose and urgency, an urgency imposed upon us by the rapid pace at which our world is evolving in the realms of science and technology. In this era of boundless possibilities, each one of us here is a stakeholder in our national aspiration to build a system that meets the scientific and technological needs of our people. I am therefore deeply honored and excited to welcome you as we embark on this historic journey together. The rules of the world in this century compel us not only to contextualize solutions to our unique national challenges, but also to draw inspiration to innovate. This has been a cardinal message of His Excellency, President Bola Ahmed Tinubu, GCFR. What has brought us together here today, the Grand Challenges Nigeria initiative, is a call to action. It is a timely intervention that aligns with the agenda of this administration while driving advancements in public health, nutrition, and sustainable development across Nigeria. While Grand Challenges Nigeria is part of the esteemed Global Grand Challenges Network, which facilitates innovation to address complex health and development issues worldwide, we are not oblivious to the peculiarities of our own challenges as a nation. This is precisely why we are doing this, to ensure that innovation underpins our efforts to solve challenges such as infectious diseases, malnutrition, food insecurity, and climate resilience, all while delivering the Sustainable Development Goals, SDGs. Your Royal Highness, distinguished ladies and gentlemen, Grand Challenges Nigeria is more than a response to problems. It is an avenue to promote groundbreaking research, build local expertise, form strategic partnerships, and engage communities in co-creating culturally relevant solutions. At its heart lies a commitment to inclusivity and gender equity, ensuring that marginalized and underserved groups across our nation are not left behind. I am confident that our co-travelers, the Federal Ministry of Innovation, Science and Technology, the Nutrition Society of Nigeria, and all stakeholders fully understand the stakes at hand. Our collective commitment to the success of GCNg cannot be overstated, and this administration is steadfast in its resolve to provide the support needed to turn our aspirations into lifelines for our people. Our gateway to innovation is rooted in recognizing our place within the global community. We must believe that our progress is intertwined with the progress of the rest of the world. This belief inspires us to work together to create a world where every country, regardless of historical disadvantages, can contribute novel ideas and pioneering technologies. Nigeria will continue to claim its rightful place in the global quest for order and progress. Science provides the most practical vehicle for this journey of possibility. A nation that does not prioritize the health and well-being of its citizens is destined for stagnation. This is why people are at the very center of GCNg. The innovators, the researchers, and the community leaders who are empowered to develop scalable solutions to our most pressing challenges. This initiative is also an opportunity to reaffirm our commitment to inclusivity and equity in serving Nigerians, especially the underserved. It is time to strengthen the capacity of our researchers, healthcare providers, and innovators to lead in health and sustainable development. We already have an array of programs, including the Nigerian Health Sector Renewal Investment Initiative, the Social Investment Program, and the Nutrition 774 program, all of which stand ready to absorb the expertise we are cultivating. The call for innovation in our health sector has never been more critical. What Grand Challenges Nigeria promises is a transformation, a transformative initiative. A Nigeria where every child has access to proper nutrition, where every family can rely on the quality of our healthcare system, and where our public health metrics continue to improve year after year. I beseech every stakeholder here today to join the noble endeavor as we prepare for a rapidly changing world. Your Royal Highness, distinguished ladies and gentlemen, it is my pleasure, in partnership with the Federal Ministry of Innovation, Science and Technology, the Nutrition Society of Nigeria, and all program partners, to officially launch the Grand Challenges Nigeria National Initiative. It is also with great anticipation that I announce the first call for proposals on advancing innovative solutions for maternal, newborn, and child health. I eagerly look forward to witnessing the ingenuity of our best minds, whose innovations will receive the funding and support they deserve through this initiative. Thank you, Your Royal Highness. Thank you, distinguished ladies and gentlemen. Honorable Minister, members of the National Assembly, I truly appreciate you. Our development partners, I genuinely adore you. To our friends in the media, I honestly thank you. Thank you, and may God bless the Federal Republic of Nigeria.
Minister, sir.
Loud round of applause. Yes, as I invite for the unveiling, the Honorable Minister, our own sister, Mrs. Uju. I'd also like to invite Honorable Chief Geoffrey Naji, of course, His Royal Highness is already there, Professor Folake Samuel, President, Nigerian Society of Nutrition, as His Excellency, having officially launched, will now ensure that we'll see what it's all about and the full birth of Grand Challenges Nigeria is on board. Your Excellency, our Vice President, the action is yours.
It's my singular honor and privilege to unveil the Grand Challenges Nigeria initiative.
A big round of applause. That's it. The Grand Challenges Nigeria has been birthed, and we'll move on to a better food-secured Nigeria for all. We'll have photo sessions, Your Excellency, here. Can we have members of front seats, please join? Please, sir, can you join, both of you? Thank you. Thank you. Can we all please remain standing as we observe the national anthem? Can we have the national anthem, please?
Our own dear native land, though tribe and tongue may differ, in brotherhood we stand. Nigerians old and proud to serve our sovereign motherland. Our flag shall be a symbol that truth and justice reign.
very much. Thank you for being part of history. His Excellency, the Vice President, would leave us and we'll just retain our positions, and thereafter we can network. Have a wonderful day in Abuja, and may God bless Nigeria. Okay, well, I would please, I've been asked to plead that members of the Nigerian media should remain behind for a short parley immediately after, in the next 5-10 minutes. God bless Nigeria. Congratulations, Grand Challenges Nigeria, Professor Folake, Samuel, and your team. May God truly bless this, and may it be indeed what we need to secure our country for food security. Thank you, ladies and gentlemen. Have a wonderful day in Abuja.